Good day. Welcome to this ABSA Insight Series. I am Fifi Peters. In today's session, we focus on healthcare and specifically how the vaccination impacts economic growth. Liza Eustace, the head of healthcare, construction and hospitality at ABSA, joins us to explain this in more detail. Liza, thanks for joining the program. Just talk to us about the economic implications or the economic cost of Africa's presently low vaccination rates and what it could potentially mean for our recovery from COVID-19.
Thanks, Fifi, and hello to all your listeners. I think you've touched on a very important topic. I think that an unvaccinated continent is the biggest risk that we have to economic recovery and growth. An unvaccinated continent will forever mean we're subject to further waves and lockdowns within our country, which we've seen has had a devastating impact on the unemployment rate thus far. And unless we get ourselves vaccinated, we are going to allow the virus to mutate, and which will then continue to leave us on the red list from the rest of the world. Again, having further impact on our industry, especially in the tourism sector, as we've seen of late. So if we could get ourselves vaccinated, we are less likely to contaminate others. We're less likely to get severe disease and require hospitalization. But more importantly, we will break that chain of transmission. And as a result, it will lessen the pressure that we see in the hospital sector. During the waves, we encounter large utilizations from the COVID pandemic, which prevents the treatment of other critical diseases. Interestingly, in Africa, we've had a massive setback in the treatment of HIV and TB, which has decreased by almost 20%. And so we are fearful of the long-term impacts this will have on our economy.
Initially, the challenges to vaccinating more Africans, I believe, was around supply, right? We couldn't get enough supply in some parts of the continent. But those challenges have now been compounded by the challenge of hesitancy and fear, perhaps, propelled by fake news around the vaccine and what it will do. In your engagements with the various stakeholders that are involved in this process, what is your sense on what business and perhaps even the public sector is thinking around doing to curb some of the challenges to getting a lot more people vaccinated, from supply challenges to hesitancy as well?
So I'll touch on your supply challenges first. I think that is a critical point that's come out of my conversations with the key stakeholders, is that the importance of local manufacture, it really needs to be at the top of minds for the country. Unless we start to produce vaccinations ourselves, we will forever be at the queue from the rest of the world. Case in point is Aspen and J&J have allowed for fast tracking the supply of J&J vaccines, a single dose, which is well suited for the continent, into the country. So, local manufacture needs to be top of mind and will be critical going forward. I mean, it started with the lack of PPE and medical devices in the beginning of the pandemic. And now, vaccines we've seen with less than 2% of the continent being vaccinated. It's critical that we fast track this going forward. The second issue that you touched on is what we've seen is in terms of hesitancy to get vaccinated. We talk about this a lot as health illiteracy and not really understanding the benefits of vaccinations. But the facts actually speak for themselves. If you look at our hospital groups, the infection and deaths of the frontline workers in wave 3 versus wave 1 have significantly decreased. And we are unfortunately seeing the ICU and high care beds home to the unvaccinated. So as soon as we start to empower patients that the vaccination is safe, this is the quickest path to getting the vaccination program underway and reaching herd immunity, which is critical in kickstarting the economy to recover and to grow.
Just sticking then to the issue around supply and the need to capacitate local manufacturing, what role or should private sector players like yourselves as ABSA play in that regard, in pushing perhaps the race for South Africa or Africa to manufacture its own vaccine at a quicker pace?
The private and the public sector, I need to touch on that topic, has a very critical role in achieving that goal of local manufacture. So, we've seen BioVac recently form partnership with Pfizer going forward, which I think is going to be, again, putting South Africa on the map. And whilst local manufacture on behalf of global multinationals is not the end game, it's certainly putting manufacture on the continents, on the map in terms of what we can do. And it is allowing us to fast track the delivery of vaccines across the continent. So the role that we can play in the private sector, such as a financial institution, such as ABSA, we can support companies in their manufacturing capabilities through balance sheet and advisory services. And then we can hold webinars like this to raise the awareness of the importance of local manufacture, to stimulate the right dialogue, and to ultimately increase collaboration between the public and private sector, which I think is going to be critical going forward.
What kind of measures do you believe need to be taken by all stakeholders involved, from the private to the public sector, to ensure that the cost of distributing the COVID-19 vaccine or any vaccines that we need to manufacture in future is not a bottleneck to the rollout?
It's a really good point about logistics. If we look at the cost of logistics in Africa versus the rest of the world, it's currently 10 times more expensive. So that cost absolutely needs to come down. As I've mentioned, predictable and sustainable demand is going to help with the economies of scale of actually manufacturing. But as far as distribution is concerned, there needs to be an increased use of data and technology to digitally integrate supply chain across the sector. There needs to obviously be improved infrastructure and development, so you can physically get vaccines to areas of the continent that currently are more inaccessible than others. And I believe the Africa Continental Free Trade Agreement that was established in January 21 will also assist with trade across the continents. So, tariffs. There will be no tariffs between countries, and it also will be a conduit for the sharing of information across the continent that will be critical in supply and demand for the vaccines.
And just on your point around the collaboration between all parties that will be needed going forward, a collaboration that is one that's continuous rather than one that is an exception or response to a crisis. How would you describe the current landscape for bedding down that collaboration in terms of, is the business environment conducive enough? Is the policy environment friendly enough? And what perhaps needs to change or be improved to facilitate things like PPPs being business as usual, as it were?
I think the working relationship between the public and the private sector, if I call it triple Ps, has improved significantly during COVID-19. And I think that's been spearheaded by Business for South Africa, which initially at the pandemic assisted greatly with the supply of PPE and medical devices, and more recently have really driven the rollout of the vaccines. The likes of Discovery, Dis-Chem, Aspen have really come together to assist with manufacturing and distribution. So I think the platform has been set. I think that it has demonstrated the ability of these two regimes to work together. And going forward, you need to leverage your weaknesses and your strengths together to be able to continue to react to pandemics going forward. And by working together, I believe that you'll be able to address many of the shortcomings that we see in the healthcare sector. And these will be, the training of frontline staff, being doctors and nurses, which is absolutely critical, and one which, in the first wave was one of the most important factors in terms of pressure on the hospital systems. The second would be to increase our access to the uninsured market, which we've been able to do through the collaboration at present. Then lastly, it would be to adopt some of the best practice management that you see in the hospital system through skills transfer and leadership and management across the entire sector.
Just taking a step back from COVID-19 and just looking at the broader health sector, what is your outlook for Africa's health sector, just given where we're coming from and given where we need to go?
I think the outlook is looking positive. Surprisingly, the healthcare sector was under extreme pressure during COVID-19. You look at the hospitals, which rely hugely on the elective surgery income, some of them up to 80%, were severely impacted. So whilst they're on a strong recovery, I think COVID-19 is going to be around for some time. And so there is going to be pressure on the hospital systems unless we can get the country and the continent vaccinated. I think that, with NHI in our future, the working relationship that we've seen currently has shone a new lens on how we can work together. And I think that has had a positive spin on what is possible if these two regimes could work closer together and collaborate. So I think that for me, the outlook it's twofold. It's positive in that I think we've got a good platform for PPP collaboration, but I think that we're going to need to increase the drive for vaccinations before the healthcare sector can recover. And ultimately, we need to watch that the cost of healthcare doesn't escalate on account of increasing COVID illnesses, which we've come to know as long COVID. And it'll be interesting to see how this will affect the cost of insurance from a private insurance sector going forward. And so again, vaccinating is going to be critical to keeping costs down and for the economy to recover and grow in general.
I would agree, just given the fact that this virus and beating this virus is so integral to our economic recovery and sort of a better livelihood for all of us involved. But Liza, we'll leave it there. Thanks so much for sharing the detail and the facts with us. That was Liza Eustace, the Head of Healthcare, Construction and Hospitality at Absa Corporate and Investment Banking. And that brings this episode to a close. Thanks so much for watching. We'll see you again next time. Goodbye.